Obviously, at the beginning of an outbreak, we have many more people who are not isolating, and then as the outbreak unfolds, more and more people will be away from others and not a risk to public health. There were some 38,987 test results received overnight. We thank each and every one of those nearly 40,000 people for going and getting tested. We are producing those results the day after the tests are taken. That's very important. That timely information is critically important to our contact tracing and to our outbreak management. Again, we thank everybody for going and getting tested this past weekend. I can confirm that since July 12 we've had 1 million test results come back through, so that's 1 million people who've gone and been tested. It's a fantastic effort and it's central to our fight against this virus. I want to also make mention, yesterday we had some significant announcements about expanding access for 18 to 39-year-olds to the AstraZeneca vaccine, and also some additional Pfizer appointments. We've had around 15,000 appointments have been made. Extra appointments have been made just since yesterday. We'll look to add more sites. We'll look to have more vaccine available. We'll look to have more appointments available over coming days and weeks. And that's a fantastic response to announcements only made yesterday. Some of those sites are already fully booked out till the end of August. There are still appointments there, and I think Jerome will speak to some additional Pfizer appointments that are available, many thousands of them in fact. But we knew that the AstraZeneca expansion yesterday would be very popular, and we see many people, around 15,000, that have made a booking, others I'm sure beyond that who haven't been able to yet, but we will add additional appointments as we can. Now, turning to some very positive news, after 4 days of lockdown and no cases in regional Victoria, I'm very pleased to be able to announce that Cabinet, both last night and confirmed this morning on advice from the Chief Health Officer, regional Victoria will be released from these lockdown measures and will return to the settings, snap back to the settings that applied last Thursday from 11:59 p.m. tonight. So that means the 5 reasons to leave home are no longer relevant. Schools will be open again from tomorrow. Hospitality venues will be open. People will be able to go back to work if they're an authorised worker, but if you can work from home, you should work from home. That is a very important decision, one that's made on the best of health advice, and one that is fundamentally the function of not having cases in regional Victoria. That's very important. We do have a conservative approach to these things. We don't want this virus to spread, but this is very positive news and speaks to the fact that we do have a degree of containment around these cases. There is a degree of localisation, if you like, to these cases, and pleasingly we haven't seen cases in regional Victoria over these last 4 or 5 days. So I'm sure that'll be welcome news to every single regional Victorian. Just on enforcement, the Victoria Police will be out in force, enforcing these rules wherever you are in the state. I would ask people to use common sense and good judgment. Don't travel to regional Victoria unless you need to, and indeed retailers and other businesses who are providing goods and services will be relying on them, as we have in the past, to be establishing the address of any customers. So there's no point going to regional Victoria. You won't be able to buy so much as a litre of milk without establishing that you're from regional Victoria. So no one from Melbourne should be going to the regions unless they have a valid reason, whether that be education, caregiving, work, where that is a permitted job, so on and so forth. People from regional Victoria can travel through Melbourne to get to another part of regional Victoria, but they need to use common sense and good judgment. This is all very simple. We are all in this together, and no one should be making any decisions that contribute to the spread of this virus. Please make good decisions, sound decisions, use common sense, and don't put at risk the fact that we have little, if any, virus in cases, that is, and virus in regional Victoria, and we're allowed to take these proportionate and very important steps to reopen back to the rules as they applied late last week in regional Victoria. I might also note that we've seen a very significant partnership between the government and all our contact tracers and all of those community leaders who are reaching out to different communities as part of this outbreak. The Altaqua College, I want to thank them for the amazing efforts that they've gone to. We've got something like 85 to 90% of all of those who needed to get tested have been tested. That, I think, is probably one of the highest and fastest performances we've seen of any school anywhere, not just in Victoria, but I think that'd rank very well across school outbreaks right across the country. I thank parents, teachers and staff and of course students who've gone and got tested and done so fast. That's critically important to us closing down, change of transmission and being able to get around this and ultimately get out in front of it so that we can change these rules and have all of Victoria open again, as regional Victoria will be from 11:59 p.m. tonight. You'll have many questions, I'm sure, but before we go to questions, I'll just ask the Chief Health Officer to speak to these decisions and some of the cases. Then Jerome can take us through some of the details around outbreaks and some additional vaccination slots that are available in coming weeks, and then we're happy to take any and all questions you have. But today's a good day for regional Victoria, and in many respects a positive day for the whole state. To have 11 cases, we'd always prefer none, but 11 cases, they're all linked. We're starting to see now the first of the new cases coming through that have been tucked away, no risk to public health. They've been in ISO for 100% of their infectious period. That's the system working as it should, but we're still chasing very hard. We're not out in front of this yet. I think we're running alongside it, but we're not yet in front of this particular outbreak, and that's why we need people to get tested as soon as they have symptoms, isolate when they're asked to do so, access those payments. There's $450 if you can't go to work because you're waiting for a test result. There's $1,500 available to you if you've got to isolate because you've got the virus or you're a close contact. Those payments are there to be made. They're very easy to access. They're all about making sure that people can do the right thing, not just by their own family in terms of providing for them, but the right thing by every family by following the rules. Victorians are doing a great job in difficult circumstances. The traffic data is and not just the data, but anecdotally driving in and out of here yesterday. Very little traffic on the Monash, people doing the right thing, and I'm deeply grateful to each and every Victorian who is following the rules. That's what drives these numbers down. That's what gets us open again as soon as is safe. I'll now ask Brett to add to my comments, then Jerome, and then we're happy to take any questions you have.
Thanks, Premier, and good morning. So certainly we've always said that restrictions shouldn't be in place for a moment longer than is required. There's always a judgment involved in that decision-making, but it is my judgment that regional Victoria's gotten to that point where we can ease restrictions. We always look at a number of factors, the risk, but also the consequences of making these changes. We saw consequences play out with a super spreading event at the MCG, where people come from across the state of Victoria and then return home. That's a particular risk. We haven't really had those events in this most recent outbreak. Therefore, there are no cases in regional Victoria. We've seen some wastewater detections in the regions, but they might be reflective of a time when we were still free to move about the state. We follow those wastewater detections over time. There have been no new unexpected wastewater detects the last couple of days, which is a positive sign, but we'll keep an eye on that. We also know that people are testing. We're chasing up all of the cases that we've got here. We're finding all of the new cases in people who are linked and finding those primary close contacts, and increasingly we'll see those individuals in quarantine for their entire period, so less of a risk of community exposure both in Metro Melbourne but also potentially in regional Victoria if, for example, they're essential workers. But there are no exposure sites in regional Victoria, no cases. There are just a few primary close contacts. So it is appropriate to ease those restrictions now in regional Vic. Some of the guarantees or some of the protections for regional Victoria relate to Melburnians knowing what they need to do. So not travelling to regional Victoria unless they're permitted to, unless there's an absolute reason to do so. And I've got confidence in metropolitan Melburnians doing exactly that. We also know it's not that regional Victorians need to be the police, but we know that they'll have a huge vested interest in protecting their communities, and they'll be on the lookout to make sure that no one is coming to hospitality services, to retail services, if they shouldn't be there. There are no changes to metropolitan Melbourne at this stage, but we have seen thousands of people as close contacts, transmission in large schools and in shopping centres, and just a few days has seen our highest caseload I think since September of last year. So it's too early to say when we can make those changes, but we know that we're now catching up with this outbreak bit by bit. I do want to say a couple of things before I hand over to Jerome. Again, huge thanks to the Altaqua College community. They went through really tough times last year with an outbreak, but this time they've really been prepared, so cooperative and really rapid in stepping forward for testing in their thousands, literally their thousands. It's a big school community, but also getting vaccines that have been on offer for the school community and families as well. Almost 3,000 people impacted, but taking everything really seriously, and we're so grateful for that. There are other schools, too many I'm afraid, that are facing the same challenge, but we're going to be working with them closely and supporting them over coming days and weeks. Finally, a big thanks to the residents of 130 Racecourse Road. They've also risen to the task again. More than 90% will likely have been tested by the end of today. That's really protecting everyone in those towers and beyond. No one family, no one individual is to blame for these outbreaks. Anyone can get exposed, anyone can get infected. We've seen that right through this pandemic. But doing the right thing is critically important, and testing and isolating and quarantining when you know that you have to is going to get us ahead of this. Again, I'm grateful to the work of CoHealth, DFFH, Council, many other community agencies, the Sikh volunteers, for example, handing out food. Just fantastic work to support everyone who's got really critical needs at this moment. Thank you, and I'll hand over to Jerome.
Thanks, Brett, and good morning. There are 11 new positive cases today. That takes to a total of 56 the number of active COVID cases in this latest community outbreak. As the Premier said, over 1 million tests now taken since the 17th of July, with almost 39,000 of those being declared overnight to midnight last night. 12,738 primary close contacts now associated with the active clusters. Almost 9,000 of those are staff and students and family members of a number of schools associated with this outbreak. It again shows how quickly this outbreak has stood up and how quickly we've activated a really significant response. With the 56 active cases in this particular outbreak, there are 5 people currently in hospital, one of whom is on an ICU, but fortunately not on a ventilator. And we, of course, send our best wishes to everybody who's recovering from coronavirus here in Victoria. I'll just run through the 11 new cases for today. 7 of them are associated with the Caroline Springs Shopping Centre. 5 of them are household members of an estate agent that we identified yesterday. One of them is another household member of somebody involved with the Jolly Miller Cafe, and another one of the cases is a customer at the Spectacle Hub. That's 7 in total for the Caroline Springs Shopping Centre. There are 2 cases associated with the Newport Football Club, a teammate and a coach of the positive case we've known about for a while. There is one further household case of the family in Newport, a young child. And finally, there is one student at Altaqua College who now is added to those numbers. And that takes us to 11 in total for the outbreak recorded today. It's worth noting we now have 14 active cases in total associated with Caroline Springs Shopping Centre, 4 cases in total with the Newport Footy Club, 7 cases in total with the Newport Family Hub Cluster, and 23 cases in total associated with Altaqua College, combination of staff and students and household members. As I said, we have a number of schools associated with this outbreak, and can I just give a huge thanks to the leadership and the wider school communities. It is very confronting to have your school and your entire community associated with a COVID outbreak, and I know that many parents and staff will be anxious about what it means for them as they go through 14 days of isolation, and of course are concerned about their own health and the health of their children. As Brett has said, we'll be with you every single step of the way. But what we have seen over the last few days is just the most fantastic response from all the school communities. In particular, at Warringah Park Special School, of the 155 primary close contacts, 88% of them have already returned a negative test result. With the Altaqua College, 2,600 primary close contacts, so a really large school community, 87% of them returned a negative test already. Heathdale Christian College, again a school of almost 2,000 people, 1,934 primary close contacts, 83% have returned a negative test result. The Islamic College of Melbourne, which started a few days later, 1,567 primary close contacts, 3/4 of whom have already returned a negative test result. And Mount Alexander College, with 755 primary close contacts, half of whom have already returned a negative test result. Those stunning return rates, the proactive nature of all those people coming out and getting tested so quickly is testament to the leadership of all those schools and the other schools that we're working with. And my thanks to them for getting the message out, for supporting the school community, and for just giving people that extra bit of support and guidance to do the right thing. And it's really helping us to get our arms around where this outbreak is going and which further communities it's maybe penetrating into. In terms of Caroline Springs Shopping Centre, we have around 400 primary close contacts identified at this point, 2/3 of whom have returned a negative test result. But we have now expanded again the Tier 2 status for this site. So if you're in Caroline Springs Shopping Centre between the 27th of July and the 5th of August, we need you to go and get tested immediately. We are quite concerned about a number of positive cases we've now identified from different stores associated with different movements in the shopping centre. And as we've seen before here in Victoria, we do need to ensure that we run all those little outbreaks to ground. So please, if you are using the Caroline Springs Shopping Centre between the 27th of July and 5th of August, please come forward to get tested immediately. You'll have your results within 24 hours, and it will help us to really nail down any other transmission that may have been happening at that location. There is a dedicated testing centre set up today and active now at Caroline Springs Shopping Centre. There are, of course, also large drive-throughs available at Deer Park, at St Albans and at the Showground sites. Finally, with regard to the red zones, last night the Chief Health Officer declared Cairns and Yarrabah LGAs in Queensland as red zones from midnight last night. That means that nobody will be able to travel from those LGAs into Victoria except on a red zone permit, which is only accessible to Victorians returning from those areas. Full details on our website. We have also backdated those LGAs as orange zones back to the 29th of July. And last night we contacted 7,000 people who have travelled from those LGAs into Victoria over the last 7 days to advise them of the orange status, to advise them they must get a test and isolate until they receive a test result. And again, it's the strength and importance of those orange zone, green zone and red zone permits that enables us to get hold of people quickly. And my thanks to everybody for their compliance in that regard. We continue, of course, to meet all red zone and orange zone flights arriving at the airports here in Victoria to make sure people have the right documentation. And my thanks to everybody for being so well prepared for when they do arrive. We're seeing really high levels of compliance. Finally, on vaccination, yesterday was a very exciting day at the Melton drive-through vaccination hub. It's the first one we've done here in Australia, and it's really fantastic landing. And a huge thanks to the whole Western Health team for setting it up, building on a really effective experience over the last few months, and it's a very good operation. 34 cars went through in our soft launch yesterday, safely and effectively. We have 180 cars booked in today for vaccinations at Melton, and 1,900 over the course of the coming days. So we'll be really good to see how that starts to build momentum, and we'll of course watch that with great interest. As the Premier has said, we had 15,000 people book in vaccine appointments yesterday, 13,000 for AstraZeneca, which is wonderful to see that quick response to the opening up of vaccination to 18 and 39-year-olds at 9 of our state hubs. Please continue to come forward. More AZ appointments are available for 18 and 39-year-olds. There will be a senior clinician available at each of these sites to be sure that you understand the options in front of you. We'd ask you, of course, to make sure if you have any concerns before you come, please talk to your normal GP and doctor to ensure that you're ready to make that decision. Finally, we have already 60,000 people booked in for Pfizer first dose appointments this week. There are still 5,000 first dose appointment opportunities available this week. So if you want to get your Pfizer in this week, you can. And there are 20,000. We've made 20,000 appointments available for next week and 27,000 appointments available for the week after. So we are putting again some more Pfizer appointments into the system. As fast as we get the vaccine from our colleagues in the Commonwealth, we make them available. So we really urge anybody who is currently eligible in those age cohorts or in those profession cohorts, please come forward and make those appointments, and let's get this vaccination job done as soon as we all can. With that, I'll hand back to the Premier for questions.
Any questions?
Will Victorian Police be out with roving mobile patrols to enforce the difference between metropolitan Melbourne and regional Victoria?
Victoria Police are out across the state enforcing all the different rules as they apply to different parts of the state. In my own local community in Mulgrave, there were quite a few cars pulled over the other night, I noticed, all being quizzed on what they're out for, where they live, were they complying with the rules. So it's right across Melbourne and right across regional Victoria. I would appeal to people, don't break the rules. Don't try and head to regional Victoria unless you are entitled to and eligible to do that. There's no reason to be going there. And again, a bit like we've been saying in recent days, if you make poor choices, then you may well contribute to the spread of the virus rather than driving these numbers down. But Victoria Police will be out in force, lots of different ways. They use technology, they use number plate recognition tech, the air wing, all of those things will be part of it, as well as maintaining the efforts on the Victoria-New South Wales border, which arguably is just as important, if not more important, given the many thousands of active cases in New South Wales and the fact that, sadly, it would seem that virus is spreading outside Sydney to places like Tamworth, Armidale, long way away from Sydney.
There were a number of Melburnians who would have been in regional Victoria in that sweet week between lockdowns. They might have chosen to stay. Now, what happens to them with restrictions easing in the regions if they're still there?
Well, again, let's get some specific advice for anybody who is, as you say, has stayed in place. They're probably a very low risk to public health, but let's get some specific advice for those and we will come back to you. This is principally, our message today is please don't travel from Melbourne to regional Victoria unless you absolutely need to and you've got a valid reason, a lawful reason. Don't be putting yourself in a situation where a shopkeeper is going to have to ask you or a Victoria Police member is going to pull you over and have to ask you and your answer won't be will not be a valid answer. There are fines. We don't want to issue those fines. There's fines of up to $1,800 for an individual, $10,000 for a business. That's on the spot. We can go further if we take people to court. I don't want to issue any fines. I want people to do the right thing and limit their movement just as they have been doing. At the beginning of this outbreak, so go back to Thursday last week, we didn't know where this virus was. We had to take the most cautious approach we did. We now have, unlike the last outbreak we dealt with, we don't have cases in regional Victoria. The fair and proper thing to do, the proportionate thing to do, it'll never be zero risk, but the proportionate thing to do is to reopen regional Victoria, and I would appeal to people in regional Victoria, don't come to Melbourne unless you have a valid reason to, and you absolutely have to. And if you're from Melbourne, please don't go to regional Victoria unless you have a valid reason, and you absolutely have to. As for people who've been staying in regional Victoria so far, their status, I'm happy to come back to you and get some specific advice for them.
Thank you. Were there many COVID breaches over the weekend? Did Victoria Police issue many fines? Do we know?
I haven't had a briefing this morning. I've been a bit more focused on some other matters, but I'm happy to have Victoria Police provide you with an update.
How's the investigation going into the source of these two outbreaks?
Yeah, look, we continue to run and rerun genomics. We continue to interrogate the national database of all of those genomic sequences. Sometimes you don't get an exact match. So we may never know. It is Delta. It is from Sydney. How it got here, its connections to any other outbreak, that is uncertain. We continue to run down all those active theories. We continue to do all that coronavirus detective work, and as soon as we can confirm one way or the other, we will. But sometimes you just don't get the exact match. But that's what's really concerning. You don't want to see numbers. Any cases are a real challenge. But I think what we'll see in coming days is a greater percentage of people who are getting the virus and are confirmed cases having been in ISO and not posing a risk to others. But what will remain a challenge for us is, unless and until we can work out where these two chains of transmission first began, that is a real challenge for us. So it's not for the want of trying.
There's talk that New South Wales might open up before they've eradicated the virus out of the community, or Sydney specifically. What's your opinion on whether, if they make that decision to do so, whether that's responsible?
Yeah, look, I've seen some reports of that. I can only go by what the Premier of New South Wales made clear to all of her National Cabinet colleagues on Friday. They may be in a position to ease some rules in some weeks' time. I wouldn't describe that as opening up. We have an agreed National Cabinet framework, and that is that they can't open up, nobody can open up and move to the next phase until we're all at 70%. Then there'll be further steps to take as a nation once we're to 80%. We're all of us, because of supply, we're all a long way away from those numbers. But the rules could change, though, in New South Wales in some weeks' time, depending on cases. We wish them well. I sincerely hope the rules can change, because they've driven their cases right down.
The GAT test is this week. Will that be postponed, or will regional kids be allowed to sit at this
The Education Minister. So school will be back from tomorrow morning in regional Victoria. That will mean there are some students who live right on the border between local government areas in metro and regional who will travel from metro to regional school. That'll be done, as safely as it can be. We don't think that's an undue risk. In terms of the GAT, I've got no announcements to make about that today. We're looking at that very closely, and the Education Minister will have more to say about that soon.
Will there be potentially a two-tiered system where regional kids sit at metro kids?
The reason we have special consideration is for exactly this purpose, so that each and not a matter of having to apply, but a consideration of where every single student is at and where they would reasonably have been viewed as being where they would have been, where it can reasonably be assumed the level of attainment versus where they're at, and the difference is factored in. It's not you don't have to fill in forms. It is an individual process for every single student, and the Education Minister's made it clear that that will be used again this year. That will take account of any unique circumstances, and particularly any differences in settings between regional students and metro students. We want to get them back on the same footing as quick as possible, and the best way to do that is get these cases under control. And the best way to do that is for people to come forward and get tested, follow the rules in the meantime, work with us to drive down these cases.
Can you explain to regional Victorians why they were locked down in the first place?
Because we didn't know where the virus was. And now, 4 days later, we don't have cases in regional Victoria, and with a much greater degree of confidence, we can return to the settings as they applied on Thursday. You've got to take a conservative approach, particularly with Delta. You only get one chance to act fast. You can't wait around for days. You can't wait to do what might be popular. You've got to do what's right. And the advice was lock everything down. Now we haven't got cases. I don't want cases in regional Victoria. I don't want cases anywhere. But we don't have cases in regional Victoria, and now we can safely take these steps. Let's keep it that way, though. So people from Melbourne should not be travelling to regional Victoria unless they absolutely have to, and they are permitted to do so under the rules. The rules are well known. We've been, living with them for 18 months. Don't be travelling into regional Victoria and potentially taking the virus with you unless you have a lawful reason.
If the lockdown in Melbourne is extended, would you consider reintroducing the ring of steel between the regions and the cities?
No, I don't believe so. And the reason for that is there's no comparison, sadly. There's simply no comparison between Melbourne and Sydney. And I've got a border to defend between Victoria and New South Wales, and I'm not going to shut half the police stations in Melbourne to do something that Victoria Police and the public health team don't think we need to do. There's 50, 60 active cases versus 5,000, I think, in New South Wales. So that's where a ring of steel should be put on. That's my view. I've made that view. Whether it's popular or whether people like me putting that view, tough. There should be a ring of steel around Sydney. Then we wouldn't have to be, defending our border as much as we are. But that's the decision of the New South Wales government. We'll just push on and do everything we can to keep the virus out.
How many people have been potentially exposed at the Joan Kirner Hospital, and are you worried about the cohort that might have been exposed to the virus there?
Well, I just want to stress that the patient in question, who is now a case, didn't do anything wrong. She was getting care that she needed. It's a complex matter, and I think you probably have some sense of the sort of care that she was getting. I think we're still assessing exactly how many people need to be furloughed. We're still doing testing. We're still working through that as we do with all outbreaks. But obviously it's concerning whenever this gets into a public hospital or any hospital setting. But I think Victorians can be confident that we take this very seriously. Infection prevention and control in our hospital settings is critically important, and the team are doing everything they can to move as quickly as possible. And if you are contacted to get tested, then please go and get tested as fast as possible. That'll certainly help us.
Can you confirm it is a third of doctors at the Joan Kirner Maternity Hospital?
No, I can't confirm that, but if I can later on today, I will.
Has the government considered making it mandatory for public servants to get the vaccine?
No, I'm not. We're not really mandating anybody at this stage beyond, I think, aged care workers, and we're working very hard to encourage frontline workers like nurses and others who deal with vulnerable people as well. Look, I think yesterday shows you that far from having to mandate this whilst I don't rule that out at some point, we're well ahead of that now. We don't need to be doing that now, and frankly, we haven't got enough supply. But the number of people who logged on yesterday and made an appointment because AstraZeneca was available to them for the first time in state clinics, that says to me that some of the hesitancy that we all seem to be talking about is perhaps not as real as we thought it was. I reckon there are millions of Victorians who want to get vaccinated and they're just waiting for the supply to turn up, as am I. In the meantime, we'll continue to open more and more of those state clinics to AstraZeneca for 18 to 39-year-olds, and I'll boldly predict tens of thousands of Victorians will come forward and get it.
And just with that announcement, can I confirm temporary visa holders, asylum seekers, refugees, will they be able to access AstraZeneca at those state-run clinics?
Let me come back to you in terms of who is eligible and who isn't in the cohorts that you have mentioned. The overall eligibility is determined by the Commonwealth, but let me come back to you on that.
Melburnians will be looking to restrictions easing in regional Victoria and wondering what we have to do to achieve the same result. Can you give us some guidance on what Melburnians need to do in order to be in the same position?
Well, Melburnians have to follow the rules. Get tested as soon as you have any symptoms. Stay at home, only go out for the permitted reasons. And if you're asked to isolate, for instance, because you're a close contact, please do that and do it with a degree of seriousness that the situation demands. This is very serious. These numbers are not spiralling. That's a good thing. We are starting to see the first of those people who are new cases but have been away from others. They've been in ISO for their infectious period. That we want that trend to continue. It's a very good test number, the best part of 40,000 tests yesterday. We want to continue to keep those test numbers up. The main thing that each of us can do is make the best choices that contain this thing, not potentially spread it. We need to get down to a very low number of cases, if any, that have been out in the community during their infectious period. That's when we'll have the best chance of opening up and staying open. The biggest challenge at the moment is, this is running wild in other parts of the country. And, while ever we have some movement, and it's essential, freight and all that sort of stuff, people who, for compassionate reasons, get granted a permit to travel back, there will always be some risk that it gets out. That's why we wish our friends in Sydney all the very best. Their problem is our problem. We want them to get that under control. We absolutely do. And we were, I think, up until this most recent outbreak, we were beginning to renew the support that we have provided over many, many months, and vice versa. We all work together because we're all in this together.
If we were to put all of those trigger points on a bit of a hierarchy in order to get out of lockdown, will not having anyone infectious in the community for a couple of days be at the top of that list?
It's always at the top of the list. Not case numbers, but whether people have been out there potentially spreading the virus unknowingly, or whether they have been tucked away and are not a risk to public health. If you've been, we could have even quite a large number of cases, but if they've all been at home isolating from others, then they're not a risk to public health. Even one person being out in the community, though, whilst infectious, given how wildly this thing spreads, that's a real challenge for us.
And how many days of people not being infectious in the community is appropriate for us to...
there'll be
3 days, 5 days?
Well, I think there'll be clinical judgments that are made, public health judgments that are made. I doubt very much that the Chief Health Officer will speculate and give you a hard and fast number this far out. We want as few cases as possible in the community while they're infectious. That's what we're working towards. And that's why we keep saying, please go and get tested as soon as you register symptoms. If you wait 2 or 3 days and it turns out you've got it, then you will have been moving around. Even in a lockdown, you will have been moving around. You will have almost certainly infected other people. That's why getting tested fast, getting your results back fast, that's what we're delivering. But that's got to be a partnership. And then we can wrap a response around you, your family, and indeed every family, because we will help you to stop spreading it. You'll be in a very different situation. But you can't have symptoms for days and then turn up to get tested. That is not the optimal way to do this. Getting tested quickly is what's really, really important.
That's going to be out of the question, though, to lift restrictions for Melbourne. Would you agree?
Well, it's only Monday, and I can't tell you what the case numbers will be tomorrow, let alone where we'll be on Thursday. Sorry?
What does the modelling look like at the moment in terms of the plan for
Yeah, look, we have to continue to see what happens today, tomorrow. We will monitor this every hour, and we will not have this lockdown on any longer than it needs to be. But I can't tell you what I'll be announcing on Wednesday or Thursday, because it's not Wednesday or Thursday. I wish I could. I wish I could give you absolute clarity about.
But you would get an idea earlier than those days. We've got 11 cases today, 1 in the wild. That's not good.
No, I can simply say to you that no decision has been made about what happens after 8 p.m. Thursday. That decision will not be made today or tomorrow. It'll be made as close to that time as possible, so we've got the most complete picture and the most recent data. That's the way it's always been done. As soon as we can give people clarity about what next week looks like, we absolutely will. We've always done that. But we will take our time to properly consider not just how many cases, but where they were, how long they were out in the community, all of those things. And I don't for a moment pretend it's not frustrating. Everyone wants certainty about what's happening, tomorrow, next week, next month. That's not the nature of this global pandemic, particularly a virus that's changing, particularly this Delta variant.
Do you have modelling, though, that is informing these decisions?
Well, there's all sorts of modelling that's done, but well, this is not so much a question about modelling. We've got 11 cases today. Only one of them was tucked away, not a risk to public health. We need to do much better than that. We need to drive that number down further. You don't need modelling to tell you that. But there's an enormous amount of modelling that gets done over time, and that supports the decisions that we've made.
But does that come across your desk in the last 24 hours or so and given you an idea of...
No, it hasn't.
If we hit certain targets in the next couple of days, we get out of
lockdown?
No,
Simon, it hasn't. And that's why I'm telling you I'm not in a position today. Seriously, I don't think any Victorian tuning into this now expected me to announce what's happening on Thursday. It's Monday. We've got time has to pass. We've got to see cases, testing, data, all of that, and then we'll get advice. And as soon as we have that advice and as soon as a decision is made, we will be there sharing that with the Victorian community. Pleasingly, we've been able to announce that we can release regional Victoria from these lockdown measures because they don't have cases. So, things can move rapidly, but I just can't predict what's going to happen on Thursday.
Is it still sustainable to be locking Greater Melbourne down over 11 new cases a day in largely one section of the city? I mean, I understand that there's a public health risk, but there are other risks as well. Loss of business, financial loss, mental health. Is there not another way to go about this as people are slowly getting vaccinated? Is this still a sustainable approach?
Well, whether it's sustainable or not, it's the only option we have. And that's the agreed National Cabinet position. Every Premier, every Chief Minister, the PM, all the health experts tell us that with Delta, there's no option. It won't, because the thing is, if there's no lockdown, it's not 11 cases. It's a lot more than that. And again, I'm not here to be a commentator on Sydney. If you want to see whether locking down some local government areas works, have a look what's happening up there. We tried that last year. It didn't work against last year's coronavirus, let alone against Delta. I'm not here to comment on them, but we will not be instituting partial lockdowns of one LGA, because what starts as 1 finishes up as 16 or 17 reasonably quickly. In any event, we wish them well. We're not wanting to be critical of them, but you're directly asking me, would I go to a more, quote-unquote nuanced approach? No, because it wouldn't work.
Well, the reason I asked that question is because the Burnet Institute and the Doherty Institute today have basically released findings that a large number of Victorians showing COVID-19 symptoms are not getting tested. Do you think that fatigue is forcing people to just throw their hands in the air and say, well, I can't do this anymore?
Well, we've always had people who had symptoms who didn't get tested. That's been a feature of the pandemic. Not everyone who has symptoms gets tested. That's why I stand here most days, and I know it's probably very boring, but, get tested. If you've got any symptoms, there's not a lot of cold and flu around. You've got to assume if you've got symptoms, you've got COVID. And that means that you're a risk to your family and every family. Please come forward and get tested. We'll get you through the system as fast as possible. There's a $450 payment if, while you wait for your results, you are out of pocket, you can't work. Ultimately, I think fatigue and people's sense of anger and frustration, no one's pleased to be here. If frustration worked against this virus, then we would be all vaccinated a long time ago. We're all sick of it, but this is the only option we have. And that's not just my view, that's the view of every leader across our country and the view of every public health expert across the country. If you let this run, then it will be not 11 cases, it'll be thousands of cases. Our hospitals will be full of COVID patients, and anyone else beyond COVID who needs anything like an ICU bed for a heart attack or a stroke or a car accident, they won't get it. It will not be available to them.
How many Victorians have been moved into hotel quarantine because they can't isolate at home? And you did say when announcing the lockdown on Thursday that
Yes.
there was going to be a big number. You may consider having to pull international flights. Have we got to that stage?
We're not at that stage yet. I haven't got the exact number, but I can get it for you. Not all of them have gone into CQV. Some of them have gone into some other accommodation that we've been able to set them up in. I want to thank them for that. Well, there are other places we can put people that aren't necessarily hotels. So they can be housed elsewhere. So we have many people. I'll get you the number. I don't have the exact number this morning, but I'll try and get you an update on that. But we're not yet at a position where we need to cancel flights. If I do need to do that, then I'll write to the Prime Minister and we will. The key point there is that it's not just about rooms in the hotels that would be freed up by that. It's also staff, and those staff can be repurposed to do other things, basically to get us out of lockdown. Like we'll continue to receive people from overseas for as long as we can. Once those staff can be better purposed, then they absolutely will be.
So it sounds like we won't get to that point.
Oh, we may. I can't rule it out. I'm just being really clear with you that no decision's been made to do that. But if we need to, we will.
Is there an update on the alternative quarantine accommodation facility out in Mickleham?
It's proceeding apace. The building of it is a matter for the Commonwealth Government. They have, I think, signed a contract. They've led a tender, so there's a builder been chosen. They can give you an update on how they're going. But all my briefings and my discussions with the PM, we're on track to have that built, the first stage of it certainly, which I think is around 500 beds by the end of the year. It was going to be early next year. I think we might be able to bring it forward into right at the end of this year, and then we'd expand that, potentially doubling it in size in the first quarter or so of next year.
Out the front of the food bank this morning, international students all lining up this morning trying to get help. Any announcements or concern for how they're going with another lockdown?
I'm happy to get you a full list of all the things that we've done to support temporary visa holders, refugees, international students. I think it's fair to say we have done, I think, more than many other states, and that's we're not boasting, it's just a fact. There might be more we have to do again, and if we do, then we will, because international students, international education is our biggest export. It's a highly disrupted sector at the moment, but it is important to us, and it will continue to be. I don't like seeing queues of people trying to get the food relief that they need. A lot of people are doing it very tough during this pandemic. We have provided support. I'll get you the details. If there's more we have to do, then of course we will.
Still be able to get financial support payments?
Sorry, I didn't quite get the first bit,
Regional
Bridget.
businesses still qualify for the financial support payments because they were only in lockdown for 4 days, less than the 7 days?
They'll be eligible for the payments that we've announced, and for the sake of a day or two, we're not going to claw that back. That wouldn't make any sense. In terms of federal government support, it's not so much how long you were locked down, it's whether you've lost the 8 to 20 hours or 20 hours and above. If you've had the loss in that period of time, then you're eligible for those disaster payments. Regional Victoria wouldn't have been in the hotspot anyway, so we'd be picking up the bill for that, and we will. We'll honour that. It's not so much about fitting into a neat set of criteria, it's about need, and if you've got the need because you have been away from work because of these measures, then we will provide you with the support that you're entitled to.
Can I just follow up on that, because last week the Commonwealth Government declared Greater Geelong, Moorabool and Golden Plains also a COVID hotspot, as well as Greater Melbourne. So from what Bridget was saying there, given the eligibility rules, is there a concern there, and has the state government reached out to the Commonwealth Government for any...
The declaration of the...
Geelong, for instance.
No, whether it's a declared area as a Commonwealth hotspot or not, that doesn't matter. If there's a lockdown on across the state, the Commonwealth pays that income support in the hot zone, or the red zone, whatever you want to call it. We pick up the bill beyond that. So it's only a matter of who pays, not whether the person gets paid. If you've had the loss, if you've been away from work because of the lockdown, you'll be paid. Your bill will be paid for if you're in regional Victoria, for instance, by the state government, because you're outside the zone. The Commonwealth Government pays only those bills, only that income support within the declared area. That's a matter for us, is what I'm saying. I wouldn't worry about that. It's ultimately about making sure that people who are in need get the support they're entitled to. Who picks up the tab is of no concern to them. that's why we're working together as closely as possible so that people who need that funding get it.
There's a homeless woman, she has been escorted out of the state back to Sydney. She's got a 2-year-old, she's breastfeeding a 7-month-old. Her family is in Victoria. She's been trying for 19 days to get a permit under the exceptional circumstances.
Yep.
Is 19 days a reasonable time to be waiting, and is there anything you can do to speed that up?
Let me follow up the case. I'm not aware of the individual case. There will be many people who wait quite a long time. We can only process with individual attention. I can't put 20,000 people on to look at all the different claims. We have to triage them. We have to make some judgments about which ones are at the top and which ones we'll get to later. That's why I would respectfully ask people, unless you genuinely have compassionate grounds, please don't apply. I want to get those settings changed. I want to get Victorians home as soon as possible, but only those who have got genuine exceptional circumstances the answer will be yes. The rest, sadly, it'll be no. On the specifics of that case, I'm happy to follow it up. I'm not briefed on that.
Just on border application.
Sorry, just one. What is the general waiting time for that to be processed?
We are processing as many as we can, as fast as we can. It's very difficult to calculate a waiting time because people are put into different categories, and there are some people who are applying. I'm not criticising them, I'm just being frank, where there's very little prospect of them being granted an exceptional circumstances or compassionate permit. We work through this and we've increased the staff quite significantly, but there is a lag because it's the flip side of giving everybody individual attention. The other side of that coin is it takes time. You've got to sit and review the individual circumstances. It's not a tick and flick process. But if there's any further information I can get you, I'm happy to.
Just another border application question. Yesterday you were asked about a mother in New South Wales trying to come back to Melbourne for her daughter going through chemotherapy. Her application was knocked back by the Department of Health, who said that they're only granted in emergency scenarios or end-of-life scenarios. Is going to help your family member through chemotherapy not an emergency situation?
Well, I don't want to appear cold to the challenges that family are facing, but I don't make those judgments. The people in the health department make those judgments, and sadly, we are having to say no to a lot of people who have a very strong case. That's where we find ourselves. This virus is running wild in Sydney, and sadly, we have to say no to many worthy applicants. I'm not for a moment pretending that it's easy for that family to get through. Their cancer journey is an incredibly painful thing, but some very difficult choices have to be made, and there's no getting around that.
Premier, over the last 18 months, have we not...
Sorry, just a follow-up question on that. Could you just explain what the risks are that people like this woman have to the Victorian community? Like, would it be coming from Western Sydney, say?
Well, this is not just in Western Sydney. I wish it was only in Western Sydney. It's in Western Sydney. It's in all of Sydney. Just look at the data. There are case numbers right across the Sydney area. That's why it's been declared an extreme risk zone, because to allow people to move freely without these really difficult decisions would put Victoria at extreme risk. And I do not have the luxury of being able to make the easy and popular decisions. I've got to make the decisions together, all of us, and me as the leader of the state, we have to make some really tough calls. I'd much prefer to have families reunited. I'd much prefer to have people, it's a very powerful bond. All of us who've had family go through exactly that cancer journey know how important being close to each other is during that time. I know it. My family knows it. Many families know it. Sadly, we have to make some very difficult calls at the moment.
Right, but I mean, there's so few people coming into Victoria from New South Wales. How many?
That's exactly the desired outcome.
What you want, which I'm not criticising. But how many people would be applying to help their family through chemotherapy? Like it couldn't be hundreds of people.
Hang on, I don't make the decisions on who is in or out. They are not matters for politicians to make. I won't interfere in that process either. I'll make sure it's been a thorough process. I'm advised that it has been. We send our best wishes to that family, and there may be other ways that we can provide support to that family. But it is one of many difficult decisions that have had to be made, because we can't have this virus, we can't have any more of these incursions, because we know what it means. Even a small number of cases will mean the state's locked down, and there is, without no sense of, I'm not trying to minimise the difficult journey that family's going through, but lockdown for the whole state's really tough as well for everybody. So there's a balancing act here, and it's not easy. It's very, very challenging.
Premier, has the government ever stopped to consider that 18 months into this pandemic, you used the word luxury, that perhaps compassion isn't a luxury, it's a necessity or a basic human right in situations like this?
Well, we make difficult judgments about compassionate cases. They're not easy. There's proper consideration of every compassionate claim, but I do not have the luxury of just doing what's popular. And it would be much more popular, I'm sure, to say yes to everybody who applies. But that would hardly keep the state safe. And then you'd be here asking me questions about why not just this family, but so many other families were allowed to come here, when the public health advice is that it's an extreme high risk. And we know even a handful of cases will have an impact not just on a small group of Victorians, or on one family, for instance. It will have an impact on every family. That's the incredibly difficult part about this. We send our best wishes to that family and every family for whom the answer has been no. It's very painful, it's very difficult. If we can provide any support to that family or anybody across the state as a result of these rules, of course we stand ready to do that. This is 18 months in, yes, you're absolutely right. But it's not the virus we faced last year. It has changed. And the available weapons or tools that we have are very, very limited. And keeping these case numbers low is the only alternative. There's no middle ground here. It's either very low or no cases, or what's happening to our north. I don't want that to happen.
How do you measure the other cases of ill health, financial ill health, sort of emotional ill health? How do you measure the impacts in those spheres if all we're focusing on is COVID cases in hospital beds or isolating at home?
But we're not focusing on that alone. We make judgments and take into account all of those issues. That's why I can't tell you what we're doing on Thursday, today, because it's not a tick and flick. It's a detailed process that we go through, the public health team go through, the government goes through to determine what is proportionate, what is appropriate, and then we push on from there. They're not easy decisions at all, and we know that every time you put rules on, there are consequences. And the reason the rules go on is that the consequences of not putting them on are far worse than living under these rules. Far worse. No one wants to see our hospital system overwhelmed, and that's what will happen. And I can tell you, having spoken to many nurses and many AMBOs and many doctors about last year, even the number of patients in hospital in New South Wales now is a massive challenge. A massive challenge. There's nothing easy about having 50, 100 people in ICU, 300, 400 patients admitted. Nothing easy about that at all. And that is not only really challenging for our nurses and doctors, the whole team, but it's challenging for other patients who will almost certainly have to wait longer for the care they need, even if we had 400 or 500 patients in hospital. Then of course, there are people losing their life, and this goes where the vaccine isn't. That's why we're tragically seeing people who are otherwise healthy and younger than we've seen previously in hospital, on machines to breathe, and some of them sadly passing.
There's been strong repeated detections of COVID in the wastewater in the Broadmeadows area. Are you working on the assumption that there are cases out there that we don't know about?
Yeah, look, there'll definitely be cases out there that we don't know about. That's the nature of two chains of transmission that are mystery cases. We simply don't know where they got it from, and that means there's at least a couple of other people out there who have got it. Whether they're still infectious, probably not, but who else have they infected? What other chain of transmission exists out there? That's what you do the wastewater testing for. It gives you a sense of where problems might be, and where you can then go and do intensive testing and all sorts of other things. You can engage with communities about coming forward and being part of the public health response.
And if there's AFL in Geelong this weekend, will there be crowds?
No, I don't believe so, no. I'm not certain of that. Whether there's a crowd at HBA Stadium is not necessarily at the top of my list. Apologies to Cats fans. We'll get to that if that's not right. If there's a safe way, if it is safe to do it, then we would. But I think it's best if we all just acknowledge that there's an outbreak in Melbourne at the moment. It's not in regional Victoria, but we don't want to do anything that might send it to regional Victoria. That'd be a really bad outcome. We saw it's very traumatic, I think, for communities, strong, proud, tough regional communities. But if you haven't had it in your community before, when it's there for the first time, it's really, really tough.
Premier, are you disappointed?
Samaya, you can get to Brett in a moment.
No, this song is another matter. You go.
Thank you very much, Simon. Yes, just
Sure.
your own Weimar, if that's okay. Sorry. We obviously, as the Premier mentioned, we have two separate chains of transmission. They still remain a mystery. Given primary close contacts, the only mandatory testing is essentially day 13. And if they don't do day 13, they essentially spend longer in isolation. Have we, I guess, considered the option of conducting serology tests on all of the primary close contacts from the previous outbreak, just to eliminate, whether or not any of those primary close contacts might have potentially exposed someone to the virus?
Sure. Look, certainly in terms of dealing with primary close contacts, everybody who's identified as a primary close contact has to complete a test in order to be released from their isolation. So if you don't do a test at the beginning, you have to do your day 13 test. If you don't do your day 13 test, you're extended for another 14 days in isolation. And we have used serology extensively in this latest outbreak, particularly for those new cases we've identified that we think are further up the chain. So if I look at the family connections with the Sydney Maribyrnong case, we've used serology to establish some links there. That's why we have some cases, but now inactive cases, and we've used it as part of our detective work. But look, we're confident with all the primary close contacts we've identified from previous outbreaks that we've run all them to ground, as the Premier has said, and we're continuing to do the work that says where did our two new index cases start from, what are the potential linkages between them. The genomics is very similar to cases we're seeing in Sydney, cases we've seen in other parts of Melbourne, but they're not an exact match at this point.
So have we maybe, just to be absolutely sure, categorically rule out linkages or, categorically link it, just conduct a serology test on all of those, tens of thousands of primary close contacts?
Yeah, and again, I think it's a bit of an age red herring, this one. I know it's a really exciting theory. I just don't think it stands up. That we have a really tight arrangement for these, for the 25,000 primary close contacts we had in the previous outbreak, the 12,500 active primary close contacts we have in this outbreak. They are all in isolation. 600 home visits yesterday, fantastically high levels of compliance, and everybody's completing a test. And the numbers I read out this morning, 85% plus figures for all those schools in the outbreak. People are getting tested because that's what we asked them to go and do, and that allows us to get on top of this outbreak. We don't, we're not going to go and do 25,000 serology tests for people who've already declared negative test results to exit their previous isolation.
And there's been some data crunching or modelling online to suggest if we continued vaccinating at the pace we currently are, we'd be able to get to 70% by late November. Do you have any modelling or data to suggest when we'll be able to get to 70% here in Victoria? And given we now have a drive-through test and we've opened AZ to younger people, when do you think that will speed up our vaccination?
Look, absolutely. All of our projections are that the vaccination will speed up as more supply becomes available, and we've seen that consistently in Victoria. We were first in with the high volumes on vaccination. We've done the highest volumes of any state through our state clinics, and as more vaccine becomes available, so the 150,000 doses that the Premier secured the other day will be taken up, I expect, very quickly in the next few weeks. As the real supplies of Pfizer start to become available next month, towards the back end of the next month, we're expecting a big lift-off, and the 13,000 people who signed up for AZ yesterday following the announcement, again, are an indication that we will see those rates lift. So I am expecting to see significant increases in acceleration rate as the national supply becomes available in September, October, November.
And when do you think we might be able to hit 70%? Obviously, New South Wales is talking about like mid to late September. Sure.
Look, we'll review our modelling. The key constraint, as always, has been supply. I mean, my call out to Victorians today is we've gone through now. There are close to 50,000 Pfizer first dose appointments available in the next 2 or 3 weeks. Let's get those used up, and very happy to come back over the coming weeks around future modelling. Can I just raise one other question on the Joan Kerner furloughing. So 27 medical staff at the Joan Kerner have been furloughed in association with a positive case who quite appropriately attended the hospital the other day. Western Health have very strong procedures and protocols in place for that, and they have that situation well under control. And the hospital and all of our health services continue to be safe to visit for members of the community if you have a good reason to be there. Obviously, what we are seeing in this outbreak with 9,000 or so primary close contacts associated with the schools, it's impacting a lot of health service workers. So we do see health service workers who are now in isolation because their children are primary close contacts, and they're of course going in 14 days of isolation, and that of course impacts all of our services across the state.
And is the public housing towers sort of situation there under control?
Yeah, look, we've seen a fantastic response at 130 Racecourse Road. So our initial focus was on that one floor where the positive cases were living. They've moved out obviously a few days ago. All the people on that floor have tested negative, and they continue their 14 days of isolation. We will complete the testing of the remainder of the building. We had hundreds of test results back last night, all negative, so we're feeling that's in a very positive space. We will continue our testing and support to all the tenants of those buildings over the coming days, but it's in a good shape, and my thanks to the whole community for the way that we've worked together over the last few days.
Non-COVID question for the Premier, unless... Yep, Premier. Sure. What responsibility does your government take for the $3.3 billion blowout that Transurban has announced this morning on the Westgate Tunnel?
Well, that's not a settled figure. I'm just about sick and tired of some of the games that are being played here. Transurban came to the government with this project. They chose the builder, and they need to get an outcome with their builder. Beyond that, given that this is the subject of all sorts of legal action and maybe even the subject of further legal action, I'll say no more than that. The Minister Allen, will be out, I think, doing not an in-person, I think a Zoom conference a bit later today, and she can take you to any further detail that's relevant.
Premier, just finally, very quickly on the regions, any chance...
It's a big call if it's finally. will it be finally? It's all right, keep going. On the regions. Any chance of Mornington Peninsula and the Yarra Valley being included in the regions and having their restrictions lifted? No, they're part of metropolitan Melbourne and have been for a long, long period of time, and I know that that's sometimes frustrating, particularly in relation to the rules, but it also has its upsides as well. It's not all bad. The ultimate thing here is we need to get these cases down. If we want to be in a position where we don't have to say no, heartbreakingly, to families who come forward for compassionate permits, if we don't want to have people experiencing mental health and distress because of lockdowns, if we don't want to have people in hospital gravely ill because of this virus, if we want to get back to a sense of normality, then we've got to drive these case numbers down, and the best way every single Victorian can contribute to that is to follow the rules, get tested as soon as you have symptoms, and play your part. Play your part. If everyone does that and makes good choices to limit the spread of the virus rather than bad choices, that deep down, as you're doing it, you know that going and visiting someone in their house is not allowed for the best of reasons. It's wrong and it shouldn't happen. All of those small contributions make the future much, much better. So, my message as always, if you've got symptoms, get tested, and get tested today. The rules are not for someone else, they're for everybody, and everyone, please play your part, do your bit, and we will get to the other side of this, and then we can be open with a good prospect of staying open. That's what we're all working towards.
That wasn't final, sorry.
It's all right.
From me, very quickly. If you're in regional Victoria, the northern border, for example, and you need to come into Melbourne for an essential reason, are you able to, and it's too late to return back home, are you able to stay overnight with a family member here in Melbourne?
Well, it would depend on what the essential reason was. Let me get some further advice in a set of words. But if you were coming to Melbourne for a medical appointment, for instance, and you were not able to return to the regions, well then, you would have to stay. We'd ask that you follow the rules whilst in Melbourne as if you were from Melbourne, so masks, all of those things. Places won't be open for you to go and visit. Just like anyone in Melbourne who thinks, right, I might go and visit a country town this weekend because they're open and Melbourne's shut, well, you won't get very far. You've got every chance of being pulled up, every chance your number plate gets recognised as a Melbourne number plate using some of the technology that police have got. And then when you go to a venue, large or small, you're going to be asked, where are you from? And you need to establish that you're from that local community. let's not do anything, any of us, that helps this thing spread. It's pretty simple.
Can I just clarify, for Melburnians travel to regional Victoria for compassionate reasons?
If it's a permitted reason, so caregiving, for instance, but...
What about funerals?
Let's get some exact wording. We have had some wording around that. There will be funerals conducted at 50 and weddings as well in regional Victoria. Let me get some exact wording. None of them are going to be happening between now and midnight tonight, so we'll get some wording for you and be absolutely clear. No one would want to go. No one, I don't think, would want to go to an event like that, a terribly sad occasion, and in the process of that, spread this virus. So we'll have some wording for you a bit later on.
It is the same permitted reasons, right? If you're from Metro Melbourne, go to, so work's one of them?
Yeah, if it's authorised work, then you are able, just as you are now, to travel beyond your 5Ks, but the rest of the rules apply. There'll be some students, not that many, but there'll be some students who might live in a Metro LGA but study in regional Victoria, the other side of the line. They will go back to school. We do as best as we can to make these things as simple as possible. And common sense is the best guide. If you've got that sense that what you're doing may well be contributing to the spread of this virus, please don't do it. I think that people know that going and visiting loved ones is against the rules for a good reason. It contributes to the spread of this virus, and it just means we're locked down for longer. Any other issues? Finally, there are many difficult decisions that have to be made. Many of them are tragic. Many of them are very, very sad. No one likes having to lock people out of their own state. No one likes having to lock people into their homes. But these difficult judgments are the ones we have to make. It's not open to us to do what's popular. We've got to do what's right. And this strategy will work. It has worked in the past, but it only works if all of us play our part in it. So thanks to all those Victorians who are doing the right thing. And just one more time, if you've got symptoms, get tested, and get tested today. No other issues? Thank you all. We'll see you soon.